who are from Pakistan in London. Nine 15 Anu. Thank you, Anu. Good evening, Anuj. So now we will start 9:15 sharp. Go ahead, guys. So today is June 25th, 2023, past quarter 21's free medical coding YouTube live session number 31 for CPC certification exam. Topic: cardiovascular and respiratory system coding. So yeah, today is our first question here. So now it is 9:15. We'll discuss the answer at 9:20. So all of you use your CPT books in order to find the answer. So you have 5 minutes. You can search as much as possible, but while during the live exam, you need to write it in nearly 1 or 2 minutes. So here I am giving you 5 minutes. Try to answer it properly. If you don't know the answer, don't worry. I will explain you. But you need to try for any type of answer. You need to choose any one among those four. Even I am also using my book along with me while delivering this session. So all of you guys use your CPT book. So no need to worry about the answer, whether it is correct or not. Just try to answer or try to put any one answer in the chat box. Yeah, thank you, Malik. Thank you very much for your answer. Soon we will discuss the answer in order to help others. Thank you, Sarika. So we will start preoperative diagnosis, left lung mass. Indications: patients with a mass in the left lung identified on routine X-ray presents for bronchoscopy and biopsy. So these are the keywords. It is the main purpose patient visit to the physician. So this is the condition which necessitated this one. And we will check the procedure now. So the patient was brought to the endoscopy suite. Good evening, Kavi. Suite and the mouth and throat were anesthetized. The bronchoscope was inserted. So it is the one keyword, and advanced through the larynx to the bronchus. So physician went until the bronchus. The bronchoscope was introduced to the right bronchus. Okay. Using fluoroscopic guidance, the tip of the bronchoscope was maneuvered into the area of the mass. Good. A closed biopsy forceps was passed through the channel in the bronchoscope and then through the bronchial wall. A tissue sample was obtained. So here biopsy performed. This is the confirmation that physician has performed the biopsy. A tissue sample was obtained. There were no other abnormalities appreciated in the left side and the bronchoscope was removed. The specimen was labeled to the and sent to the pathology for testing. So after the biopsy, physician found that patient has lung cancer. So we need to find the correct answer now. So if you are familiar with ICD, you can go ahead with ICD and find the answer. If you are familiar with CPT, go and find with CPT code. Hi Swati. So as usual, we will concentrate more on CPT now. So if you check 31625, what is that? 625 is with bronchial or endobronchial biopsy, singular, multiple sites. Transbronchial endoscopic biopsy, 31625. But what is the code for lung cancer? Lung cancer code is C3491. Can you check in your ICD-10 CM books? So if we check based on the ICD-10 CM, we have two options. So basically our codes all are symptom codes. So we can directly eliminate A and D. So as pathology confirmed lung cancer, so we can't code symptoms here. So we have options B and C. Among these two, we need to check. So what is 31628? It is bronchoscopy with transbronchial lung biopsy single lobe. And what is 31622? Bronchoscopy, it is a diagnostic procedure and separate procedure. So as per the CPT guidelines, we can't code separate procedures or diagnostic procedures with therapeutic endoscopy codes so that we can eliminate C here. So basically 628 is therapeutic procedure, 622 is diagnostic procedure. Based on CPT guidelines, we can't code diagnostic procedure with therapeutic procedure. So we can eliminate C. So we are left with B, 31628 for transbronchial biopsy and C34.91 for lung cancer. So here our answer is B. Got guys? Yeah, you can append the modifier, not a problem. So here our answer is B. Try to remember. Always along with diagnostic therapeutic endoscopy, we can't code diagnostic endoscopy code in any type of endoscopic procedures. Yeah, go ahead guys, check for second one. So now it is 9:25. We will discuss the answer at 9:30. So here important point you need to learn is we can't go diagnostic endoscopy with therapeutic endoscopy. So that's why we can eliminate C. So our answer is B. So now it is 9:25. We will check the answer at cancer leads to neoplasm. Sarika, here lung mass is cancer na. So cancer if you check in the ICD-10 CM, cancer, neoplasm, whatever it is, just it will lead to neoplasm. So we need to code it as cancer. Lung mass is cancer, not lung mass. Yeah, lung mass is confirmed by the physician that it is a cancer. So we need to code cancer, not lung mass. No needs. So basically, all endoscopic, most of the procedures include fluoroscopy, even though here they did not mention any fluoroscopy. Yeah, fluoroscopy guidance. Most of the endoscopic procedures include fluoroscopy. So we no need to code separately. See, if you check endoscopy guidelines here, codes 316222, 31651, 31660, 31661 includes fluoroscopy guidance when performed. So because of that reason, we no need to code fluoroscopy. Just most of the endoscopic procedures include fluoroscopy guidance. So we no need to code separately. Go ahead, guys. Now it is 9:27. We will discuss the answer at 9:32. So I will give you 5 minutes as these are very small question and answers. You can do it easily. So always whenever we code, just we need to check the guidelines, guys. So that is very easy. But to mention, as you are correct, most of the endoscopy procedures include fluoroscopy. So we no need to code fluoroscopy or any imaging guidance. We need to check the guidelines. So if anyone come, please place your answer in the chat box. Thank you, Anu. So we have 2 more minutes. So as soon as you see the question, you need to find the keywords first. So based on that keywords, you can code it properly. Thank you, Mohisin. So we will discuss the answer now. So first try to find the keywords here. So we have one keyword here. So you need to remember first thing is that whenever you code central venous catheter or PICC lines, you need to remember that code plays very important, age plays very important role as our CPT codes are based on the patient's age. So here 2-year-old male. So this is the keyword here. You need to remember that. So what physician is doing? As you know that we have PICC lines and central venous catheters. So you need to remember here physician is doing the central venous catheter. Like he is inserting central venous catheter. So using xylocaine local anesthesia, a percutaneous approach is used in the neck and venous access is achieved. A subcutaneous tunnel is created. So subcutaneous tunnel is the second keyword here. So first is 2-year-old male, which is the keyword, and next one is subcutaneous tunnel is very important keyword as these procedures are based on the tunneling or non-tunneling. So based on our operative report, we have tunneled, created from the anterior chest wall to the venotomy site and the catheter passed through the tunnel. Okay. The central venous catheter is then placed at the superior vena cava and sutured in position. So basically, in order to code this properly, we need to have multiple keywords, but based on this operative report, using these two keywords, we can find the correct answer. First one is 2-year-old male. Second one is a subcutaneous tunnel. So these are the keywords. Now we will check one by one. What is 36560? So 36560 is insertion of tunnel centrally inserted central venous access device with subcutaneous port. So do we have any port here in this document? So we don't have any port here. So in order to code 36560, physician needs to put port also. But based on our document, there is no port. So we can eliminate D here. Next, we will check 36568. So basically 36568 is for peripheral inserted catheter. So we can eliminate 3, 6, 5, 6, 8. As we discussed previously, we have two types of catheters, central venous or and peripheral. So here, based on our report, physician is performing insertion of central venous catheter. So we need to concentrate more on central venous catheter placement. So 36568 for peripherally inserted catheter. So as ours is central venous catheter, we can eliminate A. So we are eliminated D and A. So we are left with 36555, 36557. So we will check 36555 now. So 36555 insertion of non-tunnel. So there only we can eliminate 36555 also, as 36555 is non-tunnel catheter. But based on our document, here physician has tunneled. A subcutaneous tunnel is created means it is a tunneled catheter. And next we are left with 36557, which is the correct answer. What is 36557? Insertion of tunnel centrally inserted central venous catheter without subcutaneous port or pump younger than 5 years of age. So this code resembles our description of this procedure. So there are no port or pump placement along with the catheter. So here our answer is 36557C. You got it, guys? Any doubt? So first keyword is it is a tunnel catheter. Second keyword is it is the patient who is having 2 years old. And next one is here created the anterior chest wall. And fourth one, central venous. As we discussed, we have two types of catheter insertions, central venous as well as peripheral. So here we can't code from the peripheral section of the CPT code, as here physician has performed central venous catheter insertion. Got it, guys? Any doubt here? So tunnel means just basically he will go under the skin. So here if you see the word subcutaneous, so under the skin. Cutaneous means skin, sub means under the skin. So he will make the tunneling. Tunnel means it is like one way. He will create one way and he will go to the superior vena cava. He will create one path. So under the skin, that's why it is subcutaneous. Under the skin, he will create the tunnel. So go ahead and check question number 3. So now it is 9:38. We will discuss the answer at 9:43. So we need to remember that it is tunnel is just like he will make the path in order to place the catheter. So if physician creates tunnel, he will reduce the incidence of infection to patient's chest. Got Anu? What is tunnel? So it is basically you can't see with your naked eye. So physician will create one path under the skin. So you need to remember that we have two types of codes, tunneling and non-tunneling. And if you check the CPT description, it will guide you non-tunnel. Non-tunnel means physician will not create any tunnel. Tunnel means physician will create the tunnel under the skin. So check for third question now. No worries, Anu. Anytime you can ask any doubt. So if you have any doubt while doing coding or you are learning also, just mention in our Fastcoder 21 YouTube channel comment section. So as soon as we see, we will reply to you. So in order to write CPC exam, you need to do fast and mostly familiarize yourself with CPT book. So if you are familiar with your CPT book, you can code properly. So we are left with 1 minute. So don't worry, just whatever you know, just write in the chat box. I will explain you. If you don't understand, ask me, I will repeat once again. So time is over. So we will check the answer now. Patient had a dual chamber pacemaker. So put in 2 days ago. So this is the keyword here. So remember, this is the keyword, first keyword. He is having problems with the battery and the cardiologist found that it is malfunctioning. So this is the second keyword. He is taken to the operating suite to replace the pacemaker battery. Okay. So what is the exact procedure going to have here? Replacement of battery. So within 1 second, we need to choose the correct answer here. So here we need to depend on our modifiers. So first we will check 76 modifiers. What is 76? Procedure or service was repeated by the same physician or other qualified healthcare professional. So basically, based on our description of the procedure, it is not a repeat procedure. So we can eliminate A. So what is 52 modifier? It is a reduced service. So it is not a reduced service. It is a complication from the prior surgery. So we can eliminate B. So we will check 58. So basically 58 modifier is for staged procedure. So it is not a staged procedure. It is a complication faced by the patient. So we can eliminate 58. So we are left with C, 33228 78 modifier. So what is 78 modifier? We will check once. So 78 modifier we will use for the unplanned return to the operating or procedure room by the same physician following an initial procedure for related procedure during the post-operative period. As as it is a based on our global surgery guidelines, if you take, for example, 10-day global period, under 10-day global period, it will comes under 2 days ago. So we are left with 8 days here. So within the 2 days, patient is having the problem, malfunctioning of the pacemaker. We need to code it as unplanned return to the operating room for the initial procedure. So here our answer is C. As here patient is coming to the cardiologist for same initial procedure performed by the same physician, which is dual chamber pacemaker placement. So here our answer is C, 33228 78 modifier for unplanned return to the operating room for the initial procedure. Yeah, exactly, Anu. It is unplanned return. So planned means it will become staged procedure. But here unexpectedly patient got the problem. So he entered into the operating room. So that's why our answer is C here. 78 modifier we need to append. So in order to write CPC exam, you need to master in modifiers also. See here, if you check once within 10 seconds, you can keep the answer for this if you know modifiers properly. So that's why you need to master in modifiers also. So Anu, yeah, thank you, Malik. So Anu, your doubt cleared? So basically, we have planned and unplanned. Planned means before the initial surgery, physician will decide what are the steps to perform the surgery. So planned surgery becomes it is a staged procedure. So unplanned surgery becomes it is a and like complicated and we need to use 78 modifier here. So so here our answer is yeah exactly. So here it is a not staged procedure na. So it is a unplanned return to the operating room. So that's why we need to use 78 modifier. Yeah, go ahead guys. Fourth question answer please. So now it is 9:47. We will discuss the answer at 9:55. As bit long this one, so I will give you more time here. We will discuss the answer at 9:55. So modifiers plays very important role while writing the CPC as well as the while doing the live coding also. So you need to master in modifiers. So planned will become staged procedure. We need to remember that. Just try to find the keywords first. So you need to familiarize yourself with CPT book so that you can code properly. So that's why I'm not showing my CPT book here in order to help you. Thank you, Kavi. So we have 3 more minutes. So you guys are having 2 minutes to answer. Thank you, Sarika. So we will discuss the answer now. We have 1 more minute left. So time over, guys. We will check the answer now. So a 62-year-old female with three vessel disease and supraventricular tachycardia, which has been refractory to other management. Okay. She previously had pacemaker placement and stenting of the coronary artery stenosis, which has failed to the solving the problem. So what is the how can we make type C questions? I can't see here. This type of questions easy. So just we need to have good comparison skills. Yeah, after this we can discuss. So Anu. So she will undergo CABG with autologous saphenous vein and a modified Mays procedure to treat the tachycardia. So these are the keyword here. She is undergoing CABG as well as the Mays procedure in order to treat tachycardia. So the risk and benefits have been discussed and the patient wishes to the proceed. She is brought to the cardiac OR and placed supine in the OR table. Okay. So overall, physician has planned for two procedure, which is CABG as well as MACE procedure. So she is prepped and raped and adequate endotracheal anesthesia is assured. A medium sternotomy. Incision is made and cardiopulmonary bypass is initiated. Okay. The endoscope is used to harvest an adequate length of saphenous vein. So this is the keyword here. In order to select the code properly, you need to make endoscope is the keyword. So to harvest an adequate length of saphenous vein from her left leg. Okay. This is uneventful and bleeding is easily controlled. The vein graft is prepared and cut to the appropriate lengths of anastomosis. Okay. Three bypasses were performed. One to the LAD, one to the circumflex, and another distally on the circumflex. A modified maze procedure was then performed. So this is also one keyword. So here physician has mentioned three grafts performed and he harvested the graft here and he performed maze procedure and the patient was weaned from the bypass. When the heart was once beating on its own again, we attempted to induce an arrhythmia and this could not be done. At this point, the sternum was closed. Okay, these are common. So, if you are writing the CPC exam, within 1 second, you need to eliminate one answer. Which is that, guys? So, as soon as you see this question, you need to eliminate option D. Why D? Basically, 33257 and 33508 are add-on codes. So based on CPT guidelines, we can't add modifiers to add-on codes. So directly we can eliminate D, option D. So we are left with A, B, C. We can check all those. We will check 33512 first. So here we need to code three procedures. One is endoscopic harvesting of saphenous vein. Second one is bypass, triple vessel bypass, and third one is maze procedure. So we need to check three procedures here. We will check 33512 first. So 33512 is correct. Venous grafting only for coronary artery bypass. So 33512 is correct as based on our documentation, physician has performed three bypasses here. So 33512 is correct. We will check 33254. So what is 33254? So operative tissue ablation and reconstruction of atria limited. So atria are the same, other cardio limited. Yeah, 33254 is correct, but it is not, it is separate procedure. So we have differentiation among 33254 and 257. So 354 we can code only if the MOIS modified maze procedure is performed. We need to code here 33257 based on the code description. Operative tissue ablation and reconnection of atria performed at the time of other cardiac procedure limited. Example modified maze procedure. So we need to code 33257. 33254 is only physician performed maze procedure. We need to code 33254. But here along with maze procedure, physician has performed bypass also. In order to that, we need to code 33257. So directly we can eliminate A also. So 254 is basically for only maze procedure. So we can eliminate 33535. We can check that one. What is 33535? So basically 33535 is arterial bypass. So based on our documentation, PGC has performed vein bypass. So we will eliminate B also. So we are left with answer C. So our answer is here C. 33512, 33257, 33508. Any doubt guys here? So Kavi, did you get the answer? So you need to remember that we will not add any modifier to add-on procedures or add-on codes. That's why D is wrong. And Sarika? Yeah, correct. That is the CPT guidelines. We can't add any modifier to add-on code. That is the basic CPT guideline. So that's why we need to follow that. So Sarika, your answer is A. So we can't code A here. Why means we will code 33254 if the physician performs only maze procedure. But here physician performed along with maze procedure, he performed bypass also. So we need to use 33257 here. So our answer is 33512, 33257, 33508. No worries, Kavi. Just time next time you can remember this surely. But in exam, while writing the exam, you need to remember all these basic things. So what about other guys? Did you understand this answer? If you have any doubt, you can ask now. So otherwise, you can ask later also. But if you ask now, it is better. So that in the flow we can explain. Okay, Sarika. So we will go ahead with question number 5. So go ahead and try for question number 5 now. So now it is 10:03. We'll discuss the answer at 10:08. Yeah, no worries, Kavi. Just try to remember that basics. That's enough. Just you need to remember the code description and the basic CPT guidelines. So those will be checked in the CPC exam. So if you like this session, please click on like button to motivate me. So and also this video goes to other people who can help from this session. Just you need to find the keywords first. So based on that, you can write the answer easily. So thank you, Kavi. Thanks for your answer. We are left with 1 more minute. So just we need to find the keyword. So based on keyword, we can do the correct answer. Thank you, Sarika. So time over now. So we will start reading our question here. So Mr. Y presents to the outpatient surgery for placement of dual chamber pacemaker. So this is the keyword here. After multiple attempts to manage his bradycardia medically, okay. Atrial and ventricle leads were placed under fluoroscopic guidance via the subclinic vein, okay. Testing confirmed appropriate placement and conduction, okay. The left chest was then infiltrated with epinephrine and pocket was opened for placement of the generator. Okay, the leads were attached to the generator and the generator was programmed. Appropriate pacing was confirmed. So basically, using these 7 lines, we need to understand that physician is going to place a pacemaker along with leads, two leads, atrial and ventricular. So we will check the code descriptions now. So we will check first 33213. So what is 22313? 213 is for with existing dual leads, like insertion of pacemaker pulse generator only with existing dual leads. So as per our documentation, this is the initial placement of pacemaker. So B is wrong. So what is 33235? So it is basically removal. So here physician is not removing anything. He is installing or placing the pacemaker. And what is 33214? So it is basically upgrading. So here not performing the upgrading, just he is placing the pacemaker. So here our answer is A, which is 33208, as physician is placing the new dual chamber pacemaker along with leads. So your answer is A. Okay guys. So we need to check the report properly. So exactly what physician is doing. He clearly mentioned here placement of dual chamber pacemaker. So here, so this is initial placement. So our answer is 33208. Yeah, go ahead and check question number 6. So now it is 10:11. We'll discuss the answer at 10:16. So Sarika, you need to remember that exactly you need to find what physician has done. So pacemakers are a bit confusing only as we have multiple procedures like insertion, removal, upgradation, and other codes. So you need to cautious while coding pacemakers. Yeah, no worries, Sarika. Just now you can remember that in pacemaker codes, we have multiple codes like insertion, removal, upgradation, and replacement. You need to cautious while coding pacemakers. So, Sarika, no need to worry. Just you need to remember from our mistakes. As a human being, every time we need to learn from our mistakes. So, try to remember these keywords while finding the answer. Yeah, thank you, Kavi. We will discuss within few minutes. So we will discuss answer at 10:15. You have 2 more minutes to answer this. 1 more minute. Yeah, yes, Mohisin. So we need to find the correct answer here. Yeah, once we will check now, time is over. So a 67-year-old female has CAD, atrial fibrillation, claudication, and several chronic conditions that have been marginally controlled with medication. Okay. The doctor decided that the benefits outweigh the risk for her having single vessel cardiopulmonary bypass using an arterial graft. Okay. Her medication heparin has been stopped for several days. Okay. She was admitted in the hospital a day before the surgery. Okay. In the operating room, general anesthesia was administered. After the chest is opened, the patient begins to hemorrhage and drops in blood pressure. Okay. The decision is made to stop the procedure and close the test. So we need to check the answer here. So here also we need to code this one based on the modifier. So basically 52 modifier is for reduced service. So 74 is for discontinued procedure after anesthesia, but it is in hospital or ambulatory surgery setting. So 53 is for discontinued procedure for physician services. So here our answer is D, which is 3353353, as this procedure performed in the physician setting, not in the hospital setting. So our answer is D here. Yeah. So go ahead and check with the question number 7. So now it is 10:17. We will discuss the answer at 10:22. Hi, Pauline. No, basically 74 is for ambulatory setting. So here service is not performed in the ambulatory setting. That's why our answer is 53. So basically 53 is for physician services and 74 is ambulatory services. So now 10:18. Yeah, as I told you. So seventh question answer, please. You are correct, Pulin. Both are discontinued procedures only, but we will not use 53 in the ambulatory setting. But based on documentation, it is a this service is provided by the physician, so we will use this one. Yeah, exactly. So why means we will code this as we are working under ambulatory setting. Now we will use the 74 modifiers as ours is facility coding. If it is physician coding, we will use 53 modifier. So you guys are having 2 more minutes to answer this. So try to remember that you are writing the CPC exam. So then only you can write properly. Yeah, thank you, Sarika. You are doing good. So you have 1 more minute left. So time is over, guys. We will check the answer now. So here first keyword is deviated nasal septum. Okay. After induction, a left hemitransfixion incision was made with elevation of mucoperichondrium. Okay, cartilage from the bony septum was detached and the nasal septum was realigned and removed in a piecemeal fashion from the obstructed perpendicular plate of ethmoid. Thereafter, fluorochromic was used to approximate mucous membranes. A small amount of silver nitrate cartridge was used to achieve hemostasis. A dressing consisted of fold-up tefla with a ventilating tube for nasal airway on each side achieved good hemostasis. Okay, this is common. Here it is tefla, not telfa. This is wrong here. So we will check the answer now. First, we will check 30420. So what is 30420? So based on this operative description, you need to remember that here physician has performed repair of the nasal septum. So here our diagnosis is deviated nasal septum. Physician has performed repair of nasal septum. Usually we will call it as septoplasty in respiratory system coding. So it is a septoplasty procedure. So if you take 30420, it is a rhinoplasty. So basically in rhinoplasty, physician performs procedure on nose, not on the septum. So we will eliminate B 30420 as 30420 is for rhinoplasty, not for septoplasty. So we will check 30620. So what is 620? 620 is for septal or other intranasal dermatoplasty. So here physician did not perform any dermatoplasty, like he did not perform any procedure on the skin of the nose. So we will eliminate C 30620 and we will check 30450. 30450 is major revision, nasal tip work and osteotomies. So basically both are rhinoplasty, 420 rhinoplasty, 450 rhinoplasty. So here physician has performed septoplasty, not rhinoplasty. So here our answer is A, which is 30520. So we need to read the operative report properly so if you don't know the exact procedure, you need to check for this condition, deviated nasal septum, and you need to check for what are the probable procedures for deviated nasal septum. So based on diagnosis also you can code. So here our answer is A, 30520. So next question please. Yeah, now it is 1025. We can check the answer at 1030. So you have 4 more minutes. Yeah, yeah, good guys. So all are wrote correct answer. So no need for explanation for this question. So we need to check for whether physician has used imaging or not. As here physician did not use the imaging, we will directly select 32554, which is A. A is the correct answer. Thank you guys. So we will check the last question of the day. Yeah, go and check ninth question. So now it is 10:28. Sorry, 10:29. We will discuss the answer at 10:33. So it is also basically easy, which is also very direct question. Yeah, yeah, correct, Anu. Your answer is correct. So, so here the patient comes in today to have an arteriovenous fistula created to facilitate dialysis. So, in order to provide dialysis treatment, physician will create anastomosis between artery and vein. Okay, which usually we'll call it as arteriovenous fistula. The surgeon performs an upper arm basilic vein transposition based on the patient's previous arterial duplex scan, which is the appropriate CPT code for this procedure. So what is the keyword here? First one is diagnosis is dialysis. Second one is basilic vein transposition. So basically using the basilic vein transposition, physician will place the basilic vein in the or use the basilic vein in the anastomosis process. So he will replace it. So here our answer is 36819. As it is a direct code, you can find it very easily. 818 is for upper arm cephalic vein transposition, but ours is basilic vein. So we will eliminate C And what is 36830? 825 is creation of arteriovenous fistula only, not any transposition. 30 is for non-autogenous graft. So here basically physician using the basilic vein transposition created the dialysis fistula. So here our answer is D, which is 36819. So okay guys, with this